Okay, hopefully you can see that okay. So I'm Hannah Burnett, a PhD student at the Social and Public Health Sciences unit at the University of Glasgow. And today I'll just be presenting some of my research that explores green space visits, experiences and barriers to visiting during the COVID-19 pandemic. So I thought I'd just start off by talking a bit about why I'm looking at green space in the first place. And I realised that this webinar is focusing on the natural environment and COVID-19. So I'm sure many of you already understand the importance of green space research, but I thought I'd just reiterate this in the context of my own research. So in the surveys that I'll be talking through today, green spaces were defined as places outside of the home where you can see and experience plants, trees and nature. This can include public parks, sports fields, nature reserves, moorlands, places like that. And there's a multitude of research that's been published on green spaces and health. And green spaces have been found to promote social contact, stress reduction, self-satisfaction, positive peer relationships, and many other things. And I've got a couple of quotes on the right-hand side of the slide that just emphasize this. And these findings support the idea of green space being used as a nature-based intervention in the public health system. However, kind of a limitation of the existing research is that many of these studies measure green space access. So, for example, how close you live to your local park, rather than actual use of green space, so whether you actually go into the local park and spend time in it, which is what I'm trying to look into. And I think the importance of this research has been accentuated further by the current COVID-19 pandemic. So during the very first lockdown, which you'll probably remember well, started from the 23rd of March 2020, and at this time the UK population were only allowed out for very limited purposes. So this included to exercise or to collect essential medicines. And the UK government recognised the value of access to green space at this time and actually required local councils to keep parks open during the lockdown. And this just emphasises the importance placed on these spaces at this time. And we must understand the effect of the pandemic on green space use and how this differed between demographic groups in order to generate policy recommendations for governments in future lockdowns and also while the pandemic continues. And the headlines on this slide just highlight how green space has become a key part of people's pandemic experiences. And they emphasise why conducting research on green space is important in the context of the pandemic. For example, asking how have behaviours changed over the past 2 years of the pandemic and what are the impacts of this on the population's well-being. So how have we tried to answer this question and explore how green space use has changed during the pandemic? So we've used online surveys. And I'll just talk a bit about the survey design and sample over the 3 waves of the survey, just to give a bit of background before I go into the results. So the first wave of the survey was administered through YouGov, their UKGB omnibus. So this gave us a nationally representative sample of the UK. And this was administered from the 30th of April to the 1st of May 2020, with just over 2,000 respondents. And at this moment in time, we were in the first lockdown, also known as the stay-at-home phase. As I mentioned, we were permitted to leave home only for very limited purposes, such as to exercise once a day. And the questions on this bottom half of the slide are those that were included in this first wave of the survey. And those that are highlighted in blue are the ones I'll be talking through today, the results of. So looking at use of green space in the year before the first lockdown, use of green space following the first lockdown being implemented from the 23rd of March. And then if the participant had visited green space, they were asked about their change in experiences of green space during the lockdown. So we'll be looking at mental health benefits. And if the participant hadn't visited green space, they were asked about their reasons for this lack of use. For example, were green spaces closed or were they worried about social distancing and accessibility? We also collected demographic data with the surveys, and today I'll be looking at sex, age, and social grade. So when we conducted the first wave, we kind of thought this might be a one-off, but as the pandemic continued and lockdowns were kind of relaxed and re-implemented, we conducted a follow-up survey, also known as Wave 2 of the survey, again through YouGov's UKGB omnibus, with just over 2,000 respondents. And this was run just over 6 months after the first wave, so in November 2020. And at this moment in time, England were in the winter lockdown, but educational establishments were open. In Scotland, almost half of the population were in the strictest level 4 restrictions, which meant you weren't allowed to meet others indoors and you're only allowed to go to essential shops. And in Wales, they were just out of a firebreak lockdown, so schools, cafes and gyms were just reopening. And we added a few extra questions to the survey. So we asked participants how their green space visits changed at this point in time compared to the first wave of the survey during the first lockdown. We also asked them about their change in visits compared to the same time last year. And then we also asked them about health-related reasons for not visiting green space or visiting less frequently, as this kind of directly impacts my PhD topic. And then finally, we did a third wave of the survey. So this was again through YouGov's UKGB Omnibus, and this was conducted exactly 1 year after the first wave of the survey. So then we were able to look at how change in green space use differed over the whole of the year. So at this point, restrictions were just being eased in the UK. So non-essential shops were opening, you were allowed to meet others outdoors, eat outdoors, play sports, and also travel outside of the local area. We also asked the participants about their vaccination status and also their housing type and tenure. So I started off by analysing these surveys individually, and more recently I've combined them into one larger data set to compare the use of green space over the first year of the pandemic. So following the creation of this combined data set, I've been analysing them in terms of descriptive statistics, so looking just at counts and percentages, as well as weighted binary logistic regression models, so looking at differences in sex, age, social grade, as well as survey wave. And then I've also been looking at interaction effects between each of the predictors for each of the models, but particularly focusing on survey wave. So the table at the bottom just shows the socio-demographic variables and how they've been categorized. So sex was categorized as male and female, social grade is higher and lower social grade, which was measured by occupation. And then age was categorized into a younger age group, a middle age group, and an older age group. So now we're on to the interesting part with the results. So I thought I'd start off by talking a bit about how green space use looked before the lockdown was implemented. So this result is from the first wave of the survey, and we found that 93% of participants had visited green space in the year before the first lockdown. And when we run logistic regression models, we found a statistically significant difference by social grade. So you can see from the predicted probability plot, as well as the odds ratio interpretation underneath, that lower social grade participants were less likely to have visited green space before lockdown than the higher social grade participants. And this just shows that inequalities in use of green space by social grade already existed before the pandemic started. And then looking at green space visits over the 3 survey waves. So in the first wave of the survey in April 2020, you can see that there's almost an even split in those who had visited green space and those who hadn't visited green space. And then in waves 2 and waves 3, this increased to around 65% and 68% who had visited green space, and then 45% who hadn't visited or had visited infrequently in the last 4 weeks. And that's kind of why the percentages here don't add up to 100%, if you're wondering, is because I've got those who had visited green space, and then in the other category, I've got those who hadn't visited green space, but I've also included infrequent users of green space, so those who'd used green space once every 2 weeks or once in the previous 4 weeks, as these were the participants that were asked about their barriers to green space use, which is what I'm particularly interested in. So then looking at green space visits over the first year of the pandemic, you can see that across the different socio-demographic groups, the majority of the participants visited green space in the first year of the pandemic, except for the lower social grade participants who actually had higher percentage reporting non-use or infrequent use compared to those who had used. So this just kind of gives you a bit of a taste for what to expect from the results that I'll be discussing in the next few slides. And as expected, when I ran some interactions for green space visits between survey wave and the socio-demographic characteristics, there was a statistically significant interaction between the survey wave and social grade. And you can see from this plot, as well as the table, that over the 3 waves, the higher social grade participants were more likely to have visited green space than the lower social grade participants. And the gap between the social grade groups in terms of the predicted probability of visiting green space actually rose by 33% over time. So this shows that inequalities in use of green space by social grade were sustained and actually widened over the first year of the pandemic. And on to a more positive note, so we asked the participants about how green space benefited their mental health at this time. So you can see from the plot that in the first wave of the survey, so in the first lockdown, Participants were asked whether they felt that being in green space benefited their mental health more now, so during the lockdown, than before the lockdown was implemented. And actually 65% agreed with this statement. And then in waves 2 and waves 3, the participants were asked just whether being in green space benefited their mental health. And the majority, so almost 90% across the 2 waves, agreed with the statement. So this just emphasises the positive influence that green space was having on the population's mental health at this time. Then looking at barriers to green space use during the first year of the pandemic, so far my analysis has focused mostly on the COVID-related barriers, so looking at whether they were worried about socially distancing in green space, whether green spaces were just too busy, fearing for their health when going outdoors, for example, contracting coronavirus, themselves or a member of their household being at higher risk of being severely affected by COVID, using an outside space at home instead, and also just not being interested about visiting green space. So I won't cover all of these barriers as due to limited amount of time, but I've just picked out a few that are kind of particularly interesting. So looking at green spaces being too busy, you can see from the graph on the left that it's interesting that 9% of respondents in both wave 1 and wave 2 reported this as a barrier. Then by wave 3, this doubled to 18%, so green spaces were much busier by April 2021. And in the interaction results, there was a statistically significant finding of interaction between wave and sex, as well as wave and age. But I'm starting off with sex here. So by sex, you can see that females were more likely to report this as a barrier in waves 1 and waves 2. But then there was kind of more evenly reporting of green spaces being busy between males and females. And then I think it could be due to the result in wave 1 with females being more likely to report green spaces being busy could relate to existing research from the time that found that women were actually more likely to report following government rules to avoid leaving their home than men, and also felt more uncomfortable about returning to normal, which may be reflected in these results also. And then looking at the significant interaction between wave and age for green spaces being too busy, I think it's interesting that the younger age group here were actually more likely to report this barrier in waves 1 and waves 3, but then there was a big fall in reporting of busy green spaces for the 18 to 24-year-olds in wave 2. And this is quite different to the pattern we see in the 65 plus age group, who had a gradual increase in the reporting of this barrier. And this may be just because the 65 plus age group were potentially less likely to visit green space in the first place, due to being more likely to be severely affected by COVID, and also being encouraged to shield at this time during the first lockdown, along with those with chronic health conditions. And then looking at the barrier that's asking whether the participant was worried about not being able to socially distance in green space, the reporting of this barrier fell over time, so from 25% reporting this in wave 1 of the survey to 14% in waves 2 and waves 3. And we found a statistically significant interaction between survey wave and age. So it seemed to be more of a barrier for the younger and middle age groups in wave 1, then it fell for both of these in wave 2 and wave 3. And this could be due to a change in information reported about how coronavirus spreads, and also vaccines being implemented before the third wave of the survey. But then for the older age group, the reporting of this barrier remained quite consistent. However, by waves 2 and waves 3, they seem to be more worried about socially distancing than the younger and middle age group. I think it's interesting that the reporting of this barrier fell for the younger and middle age groups over time. However, reporting of the busy green space barrier actually increased. And this would suggest that there's a change in the perception of risk around using green space and contracting COVID in green spaces. So looking at whether the participant feared for their health when outdoors in terms of contracting coronavirus, the reporting of this barrier fell over time. So from 27% reporting this in the first wave down to 10% in the third wave in April 2021. And again, we found a significant interaction between survey wave and age for this barrier, with the older age groups consistently more likely to report this as a barrier compared to younger respondents. And this could be because older individuals were at a greater risk of severe effects of COVID. So it seems reasonable that the older respondents would report this as a barrier to a greater extent than the younger age groups. And then finally, looking at a lack of interest in visiting green spaces. So you can see from the chart on the left that this gradually increased a little by little over the 3 waves of the survey, so from April 2020 to April 2021. And we found a significant interaction again between survey wave and age, with the 18 to 24-year-olds being more likely to report a lack of interest in green space in waves 1 and waves 2. But then by wave 3, they're actually the least likely age group to report this as a barrier. And I think this could be due to a change of restrictions at the end of March 2021. And maybe the younger respondents were seeing green spaces as spaces to socialise with their friends in the spring, and therefore had a sudden interest in visiting green space compared to the middle and older age groups who potentially were being a bit more cautious. So these are just a few strengths and limitations about the data and the results. So all of the survey waves had nationally representative samples, and we included a range of variables and questions in the surveys around use, experiences and barriers of green space, as well as collecting demographic data. And we collected the results of the first wave during the start of the very first lockdown back in April 2020, which meant we could compare this with later stages and phases of the pandemic. However, we did have to recategorise some of the socio-demographic characteristics due to some smaller sample sizes. And we didn't include all of the individual variables in the analyses, for example, garden access or urban and rural location, but we have got these data, so we're able to analyse these in the future. And they were also cross-sectional in nature. However, the ability to conduct follow-up surveys with the same omnibus means that we're able to compare how the UK population used green space over the year of the pandemic. So these are just a few of the key findings from the results I've talked through today. So socio-economic inequalities in use were sustained over the first year of the pandemic and actually widened over time, with lower social grade participants less likely to visit green space over the 3 waves compared to higher social grade participants. And the COVID-related barriers reduced over the 3 waves, with participants seemingly less worried about socially distancing and less fearful for their health when spending time outside. And I think this could be linked to vaccines being rolled out, but this would only kind of explain the change in the 3rd wave of the survey. So perhaps it could be connected to perceptions of risk and also knowledge of how coronavirus spreads. We also found a change in lack of interest around visiting green space, with green spaces potentially being seen as places of socialisation for younger groups. And the fact that the majority of those that use green space felt that it benefited their mental health over the first year of the pandemic, and more so in the first lockdown than before the pandemic, emphasises the importance of these spaces for health and well-being. And it also supports the existing research from before the pandemic that highlights the positive influence that spending time in green space can have on the population's well-being. So just a bit about what's next with the data and with my research. So we've got ongoing work with Public Health Scotland's Environment and Spaces group, and the most recent report, which contains information and data from the 3rd wave of the survey, was published in August 2021, and there's a link on this slide. I'm also conducting further analysis of the 3 survey waves, especially around health-related barriers, as this directly links to my PhD, which is looking at health conditions and barriers to using green space. So asking how do barriers to using green space differ by the type of chronic health condition someone has. So I'll be using the YouGov data as well as data from Natural England's People and Nature survey to help answer this question. And to find out more, the results from the first wave of the survey were published in BMJ Open last year. And actually just last week, we had a new publication in Land, which contains the data and results around the barriers to visiting green space over the first year of the pandemic. So just to say thank you for listening to me today, and thank you for having me on the webinar. I'd just like to say a quick thanks to my supervisors, Professor Rich Mitchell and Dr. John Olson, and also to Dr. Natalie Nichols for all of their support on the study. And thank you to the Medical Research Council and the College of Medical, Veterinary and Life Sciences at the University of Glasgow for funding my PhD. And I've also got my email here if anyone would like to have a chat about green spaces at any time. So thank you for having me.
Great, thank you, Hannah. Really interesting stuff, and really good to have that sort of, although it's cross-sectional, you got 3 time points of that kind of longitudinal picture of national picture over time. So that's really good stuff, and thank you. So we've got one question already in the chat, so we're going to save questions and put them to both speakers at the end. So if you do have any questions you'd like to put, Hannah, if you can stick them in the chat, and then we'll come to those at the end. Cool. Okay. Thank you. So I'd now like to welcome Patricia Darcy. So Trish, are you still there? Great. share your screen.
Okay.
Great. Right. Over to you, Trish.
Okay, so hello everybody. So I'm going to present today on some qualitative research that we conducted as part of the Centre for Health and Development, where I'm a PhD researcher, over the COVID-19 lockdown. So it was the first UK lockdown, and we looked at exploring the role of nature engagement in supporting health and well-being during this period. So I'm just going to build on Hannah's earlier presentation with regards to providing some context and background with regards to the research, and then look at the study methodology and study design before I explore the findings in relation to policy implications and themes in the literature. So as Hannah's already discussed, nature became more important to us during COVID-19. We saw that there was an increased usage and engagement with public green spaces, but also in terms of private green space, we saw that during the first lockdown, that private green space was frequently used as the most common type of natural environment, with positive mental health and well-being effects related to greater frequency of use with this particular type of natural environment space. However, alternative forms of nature engagement may also be relevant, particularly in lockdown situations where there's mobility and social restrictions, and where people may not be able to access public green space or have access to private green space. And some of that may be related to disability or poor health with regards to accessing those type of outdoor environments. So in this instance, alternative types of nature engagement, such as digital nature, nature views, and indoor nature may be relevant. So this present research then was a qualitative exploration of how those with a pre-existing health condition perceived and interacted with nature in relation to their health and their well-being. And we were particularly interested in how participants engaged with nature and the types of nature they engaged with, in addition to barriers or challenges with regards to that nature engagement, and also benefits to health and well-being. And the aim of the research was also to help us to understand in more depth the role of nature engagement in supporting health and well-being in those that were considered vulnerable during a public health crisis. So in terms of the study design then, we initially conducted an online survey through the Centre for Health and Development in Staffordshire University, where we explored people's experiences during the first UK COVID-19 lockdown. As a follow-up to that, then, we purposely sampled from that online survey where we identified individuals who had a pre-existing health condition and who also reported natural environment engagement during COVID-19. So that was engagement with either public natural environments or private green space. Of those eligible 75 participants, we conducted 17 semi-structured interviews, either online or via telephone, with individuals who identified as having a pre-existing health condition. And just to provide an overview of those 17 participants then, so age range was from 28 to 75 years of age. 15 of the participants reported a physical health condition, and 2 participants reported a previous experience of mental ill health. There were 12 female participants and 5 male participants, and all participants had access to either a private garden space or a shared garden space, and that differed in size from small back garden to medium to large garden space, to a small holding consisting of 6 acres. In terms of the study methodology then, we took a phenomenological approach where the researchers were aimed to understand the experience from the participants' perspectives. And we did this through a process of interpretive activity which we applied to participants' meaning making. So we followed the 6 stages of IPA in doing that. And IPA was used here to give voice to those with a lived experience, where we were looking to raise awareness of participants' experiences during COVID-19 in terms of nature engagement and the ways in which policy can then be discussed in relation to nature engagement. So by exploring participants' lived experience, then we can provide valuable insight where we may be able to make recommendations regarding the potential for nature engagement to support vulnerable groups, including during public health crises. So we developed 4 superordinate themes from our analysis: COVID-19 versus nature, nature as an extension and replacement, nature connectedness, and therapeutic nature. And within those 4 superordinate themes, then there was 3 to 4 sub-themes, which I'm now going to discuss. So the first superordinate theme looked at COVID-19 versus nature, and this was a dichotomy between participants' experiences of COVID-19 in terms of the impact it had on their lives. So very much a sense of a reduced world in terms of the restrictions they faced as a result of their health vulnerability. And that was contrasted to the experiences of nature, which often was very positive and supportive in terms of enhancing mood and providing positive support for mental health and well-being. The first sub-theme in that was nature's escape from COVID-19, and nature was very much used as a way to get away from COVID-19 in terms of the realities and the fears and concerns that related to COVID-19. But it also provided a mental respite for participants from the ongoing media coverage with regards to reporting numbers with regards to deaths, case numbers of COVID-19, etc. Private green space in particular was identified as being very significant and important as a sanctuary for participants, where the boundaries of the garden space demarcated essentially the reality of COVID-19 from their private world. And within that, both public nature experiences and private garden space provided a sense of constancy and normality for participants, which was often contrasted with this fear and uncertainty associated with COVID-19. However, participants also had to adapt their behaviour with regards to engaging with outdoor environments, and that included public natural environments. So we saw that participants had modified their behaviour in terms of choosing to engage with those spaces or not. And for some participants, they felt that the risk was too great to engage with public natural environments, and they choose to engage only with private green space. So strategies were, for those that did engage with public natural environments, strategies were used such as choosing spaces that were quieter, using a booking schedule, going at a time when there's going to be less individuals there. And key to engaging with public natural environments was the benefits that participants received from engaging with other individuals. And this was important to them in terms of supporting social well-being, but also it was also a reminder of having a normalizing situations with regards to what they would have done pre-COVID. The third sub-theme within this superordinate theme was the sense of safety and control that private green space in particular provided. And this was achieved through the personal ownership of private green space and the boundary between private green space and the outside world. In addition to this, there was a sense of control with regards to private green space, where participants had fears or concerns regarding food supplies or accessing supermarkets where there was a fear around health vulnerability. So the private green space was used for growing vegetables at this point in time. The second superordinate theme then was nature as an extension and replacement. And within this, the garden as an active and passive space, public natural spaces, and also alternative forms of nature engagement were used to support participants extend their lives and to access and see places that they normally couldn't. First sub-theme includes the garden as an active and passive space. And here participants identify the importance of private green space as an extension to their house, in particular as an outdoor room. And this space was used for sitting in, for dining in, for interacting with others when restrictions eased. It also provided a sense of purpose and reward where participants engaged in different activities in terms of gardening activities or landscaping projects. But there was also a shift from a more active sense of nature engagement to passive nature engagement, where participants were willing to sit in the garden and enjoy and appreciate nature and notice nature, but also to look at the benefits of the rewards and also to make plans going forward with regards to different projects that they planned on installing in the garden or creating within their garden. Public natural spaces were also used as an extension for some participants, and this facilitated a greater sense of being away, both literally being away from the house, but also being away from COVID. And central to this was the larger physical space that public natural environments provided, but also that this space was also more biodiverse than their own private green space. And in this way, this type of natural environment was very important in supporting psychological stimulation. Other types of nature engagement also provided micro-restoration opportunities. So participants used digital nature to view places that they normally would have been able to before COVID. This included using webcam travels, online nature engagement activities, nature challenges. Nature views were also very important to participants, particularly for those that were working from home at this time, where it extended the participants' view from their immediate environment to the outside garden. Indoor nature also was very important in terms of providing a nurturing nature experience, where previously indoor nature might have been identified as being a chore. It now became something that participants enjoyed and provide positive input and positive feedback to them. Nature art was also used as a way to express the beauty of nature, as a way of a creative outlet. And again, in this way, it provided a valuable micro-restorative opportunity. The third superordinate theme then focused on nature connectedness. And here it was very much the focus was on sharing nature with others, whether that be through digital nature or nature produce, but also creating connections directly with nature through noticing nature, and all of their experiences in terms of noticing and connecting nature and the positive benefits to mental health and well-being led to an enhanced appreciation of nature. So sharing nature resulted in creating social interactions and connections that were lost due to COVID-19. So it allowed that online engagement with digital nature, and that came about through Facebook interactions. It was also participants used sharing photographs with family members and friends as a form of digital nature engagement to continue communications and support social engagement. Conversations revolved around activities in the garden and what was grown in the garden, but also conversations involved sharing ideas with regards to nature walks with colleagues in work. Opening the garden space to others to reduce social isolation was also identified, to share that physical space and to create social interaction and engagement. And finally, then participants shared their garden plants, their garden produce, fruits and vegetables, and also the creative outputs that they undertook in terms of creating nature projects. Nature connections also resulted in direct connections with nature, where participants felt at one with nature. And this was often resulted from feelings of awe, being inspired by beautiful sunrises, or looking at beautiful landscapes or beautiful bluescapes. Connecting to oneself was also central to connecting directly with nature, particularly for those who were shielding for a longer period of time. Being alone by oneself, either in private space or public natural environments, was very central in terms of that connection to oneself. In addition, there was an interconnectedness identified between nature and identity, where nature became a very powerful symbol for connecting with cultural identity, personal identity, and also professional identity. And the generation of nostalgia was central to this, where participants reflected on past memories or childhood memories of their engagement with nature. And we know that nostalgia is very powerful in terms of supporting and developing psychological resilience. And then finally, in terms of noticing nature was very important, where it became an important focus, allowing participants to disengage and disconnect from the realities and the fears and concerns associated with COVID-19. And nature facilitated this through its colours, through the seasonal changes, through the minute detail that participants observed in terms of individual flowers and plants, and also in terms of natural soundscapes, so bird song, the sounds of the wind and other nature sounds. So participants spoke about the resulting impact that nature had and nature engagement had on their health and well-being, and how that resulted in changed priorities. In particular, there was an increased appreciation of nature and of local natural environments for those who accessed them. In addition, participants felt that their behaviours would change going forward, that they now valued nature more, and they were more inclined to holiday in nature or to maybe move home to a more rural location. In addition, participants engaged in more pro-environmental behaviours such as recycling and upcycling, and also pro-social behaviours such as buying local produce and supporting local producers. The final superordinate theme then was therapeutic nature. And this explored how nature benefited mental health, physical health, and the importance of multisensory engagement and mindfulness in supporting health and well-being. Nature directly impacted on mental health by providing a restorative environment, and particularly around reducing stress. It helped people cope. It was considered a valuable lifeline. Private green space in particular offered the opportunity for a calm environment, particularly when people were having a difficult day or experiencing a stressful situation. Their experiences of nature were considered to be uplifting. It helped enhance positive mood, reduce negative mood. Participants talked about happiness and joy from viewing nature and from being in nature, and the sense of buoyancy that nature gave them. In addition, for those who were struggling with mental health or had previous experience in mental health difficulties, nature acted as a powerful green prescription and prevented any further deterioration in mental health. For those who are managing a physical health condition, then nature engagement also helps support this, and that was through public and private green space. So in terms of chronic pain conditions, participants engage with nature to help manage their chronic pain through physical exercise or through reducing stress where stress was linked to chronic pain. It also helped in terms of maintaining fitness, reduce weight loss or reduce weight with regards to gardening activities, which also helped promote sleep. And for those who are recovering from a physical health condition, being in nature, even though it was slow in terms of passive or quasi-passive nature engagement, helped to support rehabilitation. Multisensory engagement was central to this therapeutic benefit. And for those in particular who had experienced a period of shielding, they reported a heightened sensory awareness where they were more aware of nature sounds, nature smells, and nature colours. And this multisensory engagement helped in terms of enhancing mood, so greater positive mood, as I've already referred to, reduced negative mood. It also helped in terms of cognitive restoration with regards to giving participants' brain a pause. And then finally, in terms of mindfulness, nature acted as a powerful focus. It drew participants' attention away from the world of COVID-19, away from fears and concerns and worries. And in this way, it provided a reprieve. But in addition, for those who had health vulnerabilities and worries, it also provided an opportunity to have a focus beyond oneself by focusing on the beauty of nature and engaging with nature activities. So in terms of conclusion with regards to our findings, our research points and highlights to the importance of both private green space and local natural environments as important health supporting environments. And it goes beyond the evidence base in terms of looking at patterns and types of nature engagement to a deeper understanding of how participants with a health vulnerability use nature to support their health and well-being with regards to psychological health, physical health, and also social health. While local natural environments were used by some participants for psychological stimulation as a greater escape and a reprieve from COVID-19, there was also an evidence of a substitution effect for those with a health vulnerability, where private green space was used over local natural environments. In addition, various types of nature engagement with a shift towards passive and quasi-passive nature engagement was also identified by participants. And this may have implications for public health messaging, where various types of nature engagement can be used to support health and well-being. Both private green space and local natural environments were considered to be very powerful therapeutic landscapes for participants with a health condition, and place attachment may play an important role here, in addition to that multisensory and experiential experience of nature, where they have both combined to create this therapeutic impact. In terms of micro-restorative opportunities, then, the research highlights the importance of digital nature, window views, and nature sounds as opportunities for participants to engage with nature and to receive restoration. And COVID-19 pandemic may point for the need for more regular micro-restoration to manage ongoing stress associated with this pandemic. In terms of policy implications, then, both private green space and public natural environments are important health supporting environments. And the use of private green space in particular is highlighted in terms of mitigating the negative effects of any future lockdowns. In addition, with regards to public natural spaces, our research highlights the challenges that participants had with engaging with these spaces, and also highlights the importance of including vulnerable populations and disadvantaged communities in the decision-making process of designing urban green spaces. In relation to green care and green social prescribing, there may be opportunity to use digital technologies to facilitate green care and green social prescribing interventions. And nostalgia and mindfulness might play a central role in terms of the benefits or the relationship between nature and health with regards to positive health and well-being outcomes. Conclusions then, our research highlights the importance of nature in supporting health and well-being through engagement with both private and public natural environments, by providing opportunities for restoration, by using nature connection as an important pathway, and by identifying and highlighting the therapeutic benefits of nature engagement. Then I just want to thank all the research participants for contributing to the research, the PPI contributors who are involved in informing the study design and who are involved in piloting the the interview schedule, and the research team who without this research would not have been possible. So that includes Jennifer Taylor, Lorna McKay, my supervisors Naomi Ellis and Chris Kidlow, and also Staffordshire University for funding the research. And that's, I've just included the paper link below as well. Thank you.
Great. Thanks, Trish. Really good. Yeah, a good overview of a very in-depth study with lots to cover, and thanks to both of you and Hannah for sticking to time. So that's really good. So we've got 15 minutes for questions. And Hannah, are you okay to come out of the dark and take? That's it. Thank you. So we've had a few questions coming in the chat. So thanks those who have put those questions in. So I'll just try to cover some of the main points. There's been a couple of questions relating to things, well, for you, Hannah, relating to things that you may have measured but not explored yet. So consideration of, as well as use, but also access, quality of green space, proximity to countryside, types of green space. Can you comment on that, or things you did or maybe didn't measure and that you may be taking into account?
Yeah, so we did collect some, sorry, I think I'm reading back then. I did collect some data on on the quality of green space. So it was more about kind of people's access to facilities in green space, or kind of public transport access, things like that. And the kind of health related barriers are more about kind of like physical access, as well as the, like I say, access to facilities and things like that. But I haven't kind of looked into that in depth yet. So that's kind of what I'm covering in my PhD. So I'm kind of in the middle of my analysis at the moment. So I'm glad people are interested in this. Yeah, so I'm kind of looking more at that side of the quality of green space. So mostly related to kind of health related reasons for lack of use of green space. So I have got the data there and I'm looking into it. I just haven't got anything to present yet. So hopefully at another time.
Thank you. And then there was another comment about the inequalities and the widening of that inequalities in visits, which is really important, because as we know from the evidence, there is some evidence to suggest that those who are sort of lower down the social strata may have more to gain from exposure to natural environments. So the fact that that inequality in visits actually got worse over time is a bit of a worry. I don't know if you've got any comments on, we thought, why that would be the case, and whether it was related to how you measured social grade.
Yeah, I think you kind of hit the nail on the head there. I think it was about kind of how, because YouGov measures social grade in terms of occupation. So the lower social grade respondents were more kind of manual workers, whereas the higher social grade respondents were more kind of in managerial positions, things like that. So I think especially in the first lockdown, that would have impacted people's use of green space a lot, due to kind of working from home and manual workers still kind of having to go out to work, and kind of they were kind of the key of the first lockdown, I remember. I think that would have had a big impact on the gap. But I think that mostly explains the first lockdown, because then by the third wave of the survey, so in April 2021, I feel like things were kind of getting slightly more back to normal. So I guess people are still working from home now, so it could still be reflected in kind of how social grade was measured. But I think it's kind of harder to unpick the reasons for the gap widening over time, because you think that in the first wave that would have been where the biggest inequality was lying, but then it was actually the third wave of the survey, the gap had widened even more. So I think that's really, I've been trying to like rack my brains and like think about what this could be. So I'd be interested to hear anyone else's thoughts on this, but yeah, I think it's really interesting.
Thank you. And if anybody's got any more questions, or if you want to stick your hand up to ask a question, please do. And then, yeah, Trish, just one question which occurred to me is the point about the priorities and appreciation of nature actually increasing amongst those with a health condition during COVID. And based on your, I know you haven't done a follow-up of these individuals, but based on your work and the PPI and all the people you engage with who have a condition through your research over time, do you think that's been sustained? Because obviously COVID's changed, the restrictions have changed, so I wondered if that appreciation of nature had sort of been sustained over time.
Yeah, well, certainly in terms of PPI work, it definitely seemed to be the case. And I think some of that might be is because some of those restrictions are still applied to people with a health vulnerability. So while, you know, public spaces have opened up and governmental restrictions have eased, for some people with health vulnerability, they still made the choice to engage in a more limited way, and therefore nature has been very important in supporting them and the benefits that they receive from nature, but also using natural environments as spaces as well as possibly a more safe space to engage with others, where that social interaction was very important in public natural spaces. So certainly from a PPI perspective, that would be some of the anecdotal evidence that would come back. In relation to some of the participants who took part in this research, I've had some feedback in terms of follow-up, even though we haven't done any follow-up research, and some of them have made decisions to move out of urban environments into more rural environments since that. So when we did the research, they said that was their intention, and some of them have certainly followed through on that. So there does seem to be a case of, or evidence for, that this valuing of natural environments has had a big impact in terms of their health and well-being, and therefore they want to keep that going forward.
Cool, thank you. And I see we've got a hand up. Alison, you want to ask a question?
Hi, do you want me on camera or not?
Yeah, if you want to, yeah.
Hello, hi. So I'm a landscape architect, and so I design a lot of sort of open spaces and manage open spaces. And something as part of the Landscape Institute that has come about is the fact that people, the quality of the open spaces. I think I mentioned it earlier in the chat. The quality of the open spaces that are available to people in probably a less, or in a socially deprived location, are less, aren't as good a quality as other areas. Plus, we've also found that on the periphery of sort of cities and towns, where you generally get a wealthier population, they have easy access into the countryside, or they have vehicles and transport to actually get to those locations. And so they're able to experience nature in its prime form, whereas those in socially deprived locations have a mown to death piece of grass. And that is not really what I class as a natural environment or a nature-based environment. So perhaps the sort of the quality of the open space that people interact with has something to do as to whether or not they see it as valuable, you know, in terms of their interaction with nature, because they don't necessarily have an interaction with nature, because it's just a mown piece of grass. So I don't know whether that's something that maybe could be factored in or thought about in terms of why people aren't necessarily interacting with their green spaces. And I also wanted to ask, it's great having all this research, but so what is the process of moving this forward? How is that going to be implemented for the benefit of like socially deprived locations, or people who are you know, more in need of that and they don't have access to it? So how are you going to push this forward such that my job becomes much more fruitful? I'm not saying financially fruitful, but in terms of, you know, the one thing that I really, really desperately want to do is improve the quality of open spaces within the cities and towns, so that people can actually have access to them. So your data, your analyses are absolutely fundamentally important for that. But so what? If they stay as data and analysis, they don't have any use. So it needs to be moved forward into something. So that would, if you can sort of give some idea as to how you would do that, that would be great.
Yeah, can I come in there? Because I think it's the importance of you know, urban planning and urban policy taking on board some of these recommendations as well. I mean, and to go back to your point around, you know, quality of green space and that as well. So who has that input in terms of involved in that decision-making process. So our community is involved in the decision-making process of where the green space, the urban green space is going to be situated, what that urban green space looks like, how accessible is it going to be. And all of those things have a bearing and an impact in terms of the final output in terms of green space, because we know that just by providing green space alone doesn't mean that it's going to be used or that people are going to engage with, or certainly that the quality of it is going to be good. So I think there are a number of different factors and a number of different actors and players in terms of how we design and develop green space. But I think ultimately it has to be, it has to be quite an inclusive process, and that has to be both a top-down and a bottom-up approach in terms of the design and the development of urban green space. But it is taking on board the recommendations from research with regards to what Hannah has highlighted, and also in terms of the qualitative research that we've highlighted with looking at vulnerable subpopulations and what they might need in terms of supporting their health and well-being in terms of engagement with public green spaces.
Yeah, I think following from that, this just opens up like a wider discussion around the impact of academic work in general. So obviously it's one thing, like you say, doing the results, having the data, finding all of these interesting things that could be helpful, but then it's actually making sure that you can push through and actually ensure that these actually have an impact and go to the people that can make the change from kind of like, if it is a top-down way, then it's like, how do you reach these people? And I think that's a really hard question to answer, and it's just a general issue, I think, within academia, making sure that everyone collaborates and can share this data and make change with the data. Otherwise, yeah, there isn't much point of us doing all of this research.
Can I just suggest that you contact the Landscape Institute? They would be they'd love this data, because they have policy providers who go to government, central government, who can then assist in moving it forward in terms of putting it through to policy.
Well, this is being recorded, so when we send you the link for this recording, you can always send that to your colleagues there as well, so that'd be good. And just to follow on that point as well, because where we're based in Stoke-on-Trent, it's a very, very green city, but it's quite a deprived city. So although there's a lot of green space, some of it's not always of the greatest quality, and it's probably too expensive for the local authority with the budget they've got to keep all of it of great quality. And we did have one of our researchers work in the planning department and city council to sort of give us that inside view on some of the dynamics, and it is incredibly hard to change behaviours around decisions around plannings, because there's competing interests. There will be a city like this, which is not unlike others, other post-industrial cities, where the city needs inward investment development, and therefore when the developers come and there may be a health impact assessment that says yes, but you need to include this amount of green space of this sort of type, and developers don't really want to do it, they're in a very strong bargaining position, and so it's quite hard to sort of mandate what developers have to do if they're putting in new housing developments and the minimum requirements that you want, and to ensure that the open spaces in those new developments are health promoting and sufficient quality and size and all those things. So it is tricky, and especially now local authorities are under such pressure because they're often the ones in charge of these green spaces, and the budgets are absolutely decimated at the moment. So it is hard, but we're always welcome as academics to share our evidence, and if you can put us in touch with people that we can share these with and try to influence it, then we're always very welcome to do, willing to do that. We've got 2 minutes to go, and I can't see any hands up, so if we can just stop the recording there, that's all right. Oh, we've got another hand up. Okay.
So I was just going to chip in. If you've got 2 minutes as a town planner, if we've had a landscape architect on, a town planner has to talk as well. But just as a town planner, I'd agree with what was said. Basically, it's maintenance. My salary is paid by public health, so I work between public health and planning. A lot of it's about local authority budgets, but it's also about getting planning policy to recognise the value of open space. So I would suggest including, if you are looking at national bodies, the Royal Town Planning Institute, Town and Country Planning Association, they do an awful lot of work on green space. So get them involved as well and send it to them. I'm sure they will be interested. Town and Country Planning magazine He's got some very useful articles about green space. I'm sure they'd be interested in an article on the research.
Brilliant. Thank you, Rick. Fantastic. Okay, great. Well, thank you very much for your attendance, everybody, and thanks in particular to Trish and Hannah for sharing your work. And if it's okay with you, we'll make your slides available, if you can send them through. Actually, send these slides to me. We'll put them on the website, and we'll make this the link of this recording available as well. Okay, so thank you, everybody, and enjoy the rest of